everyone. Today we will be looking at the superficial anterior forearm muscles. So first we're looking at the flexor carpi radialis, which has an origin of the medial epicondyle of the humerus and an insertion of base of the second metacarpal and base of the third metacarpal, with the nerve as the median nerve, and the main actions are flexion and abduction. Next up is the pronator teres, which has an origin of the medial epicondyle of the humerus, and a coracoid process of the ulna, and with an insertion of a lateral surface of the radius. Again, the nerve is the median nerve, and the main actions are pronates and flexes the forearm. Now we're focusing on the flexor carpi ulnaris, which has again a similar origin of the medial epicondyle of the humerus and the olecranon of the ulna, and the insertion is pisiform, which actually is a sesamoid bone, also with hook of handmate and base of metacarpal 5, with an ulnar nerve attachment. And the action is flexes wrist and adducts the hand, which is also known as ulnar deviation. And finally, we will be talking about the palmaris longus, which again has an origin of the medial epicondyle of the humerus and an insertion of the palmar aporosnes and flexor retinaculum. The nerve attachment is the median nerve, and the actions are flexes the hand and tenses the flexor retinaculum. Okay, so now we're talking about a condition that is associated with this muscle group, and I've decided to touch on golfer's elbow, also known as a medial epicondylitis with the pronator teres muscle. So a definition of this condition is tendinitis at the common flexor tendon at the medial epicondyle. And causes of this condition can be repetitive loading of the flexors and pronator, and it's actually common in plumbers and carpenters. Also, the signs and symptoms of golfer's elbow are obviously pain at the median elbow, stiffness of elbow, weakness in hand and wrist, as well as paresthesia in the lateral aspect of the hand, so the fourth and fifth digits. The prognosis for golfer's elbow is with treatment, a full recovery could take up to 6 months, 3 to 6 months. And if you're still having pain after this, the client may need surgery. Okay, so now that we're talking about golfer's elbow, let's talk about how we can overcome or lessen the pain of golfer's elbow with some rehabilitation exercises, so strengthening and stretching. First, you can do active range of motion on the wrist, so both flexion and extension. You can also do a wrist stretch. Forearm pronation and supination is really great. So is eccentric wrist flexion and extension. You can also do grip strengthening, so grabbing a ball and working on your grip, just a small ball that fits in the palm of your hand. You can also do forearm pronation and supination strengthening. And then you can also do resisted elbow flexion and extension. So, is massage indicated for golfer's elbow? Yes, it is. Deep tissue massage on the forearm and using soft techniques could be used. Deep tissue massage and soft techniques could help increase mobility and ease stiffness, and therefore ease pain of golfer's elbow.